Just a minute, I'm sharing my screen. Okay, so anyone have missed any topic in a medicine, do not worry. We will revise it. Okay, whenever I will take the same topic for other batch, you can join that time. And for medicine, if you are missing any topic, then also is fine because it's not at all related with each other. Okay, so let me just start with this. So how many topics we have covered here? Immunology, psychiatric, dialysis, ophthalmology. 1 second, huh? Yeah, kitna? Tell me. Good morning. Yes. Oh, fine. Excuse me. Come. Okay, so we have completed immunology, psychiatric, dialysis, ophthalmic also done, right? Audio is pending. Yes, no, that is also done. Done, na? Audiology done, cardiovascular done, cardiovascular catheterization done. This is pending 93880 series. And allergy is pending, neurology, that NCS test, nerve conduction study, done, right? Hydrogen infusion injection, completed. Photodynamic therapy, completed. The remaining physical therapy, acupuncture, osteopathic manipulative treatment, chiropractic manipulative treatment, and moderate sedation. These are the pending topics, which is very, very small topics. Okay? So, any doubt on the previous one? All good? So let me come to directly on the topic. Did I share question paper? Yes, no? Okay. Try to complete it today. I hope you have started. No? Okay. Then fine. Then also fine. Sleep study, polysomnography, we are done, right? Polysomnography is done. EEG is pending, which is not there in a list. I remember that. Did you watch these videos? Atherectomy, angioplasty. See, in this is the biggest chapter, okay, this medicine, because we can see it's like a fifth, sixth, seventh class, right? Or some fifth class, I don't know, remember now. Okay, but it's actually very big topic, but still you will get only 6 questions from this, right? So what happened now? All the questions come a question paper in the exam. It comes in a set. It means if you 4 people are going for exam, all 4 will get different question paper. Total different, not shuffled and all. Okay. So it means it's not a 6 question. It is 24 questions. Right now, for you will get 6 questions. That's true. But that they will prepare 4 set for this. So you can work on like this then. Some people will get from question from the hydration. Some people will get from the immunization. It works like this. Very easy. Okay, so what is EEG? It is electroencephalogram or electroencephalography. We have seen ECG, right? Which is electrocardiography. Electro means electric current, cardio means heart, gram means imagine. Similar way, electroencephalography. This is for our brain. It by EEG we find the brain activity. It will not tell you what you are thinking. Okay, it cannot map like this. It can map how your brains are active or working, or what is this impulse, the electric communication, how it happens. Like this mostly will be done for the epilepsy people. Okay, because there are different. I'm just giving you one example. For epilepsy, we have a different types of epilepsy. Some will be focal. It means it is generated from the one part only. Some will be generalized from all the parts. So to decide what type of epilepsy to decide, then further we can go for the treatment. We go EEG. Okay, how it works, how it do, they perform this. You can see this. Okay, it is very simple technique. They will attach some leads on the different parts of our skull. Okay, and patient will be on a sleep, or he will be on a rest condition. If it is kids, it should be sleeping. If other adults, resting condition, they will just lie down. Procedure is for like 30, 45, 1 hour minute. Okay, and then they will get like bundles of reports, almost like a 50-page report, and with like this graph. Only doctors can interpret it. Okay, so now how our coding system is here. What our codes decided. So first thing we will see time. Okay, I told you it is for 1 hour also, 1 hour, 30 minutes, 45 minutes, 1 hour. It may long also. It may be for a long period of time also. 1 hour I'm just giving you general perspective. Okay, general EEG. They perform for a 1 hour, less than 1 hour, not even 1 hour. Okay, but it may go for a continuous hours also. Second, whether they are taking video or not. For some time they have to take video also. Third, who is performing. So if you are getting EEG question, these 3 topic you have to see. These 3 points you have to find out in your question. Who is performing, technician or doctor? For how long time? And third, whether the videography has been done or not. Done. Okay. You can see 95705 code here. They have given EEG without video.
Sir, your screen is not visible.
Yes, Afaq?
The screen is not visible.
Screen not visible. For others?
It's visible, sir.
Visible, sir.
Afaq, just re-log in once.
Okay, sir.
Maybe network issue.
Yeah, I log in.
Okay. So 95705, 706 and 707. This is EEG without video. All 3 code is for without video. Okay. Reviewed data, technical description by EEG technologists, 2 to 12 hours. So this is common for all 3 codes. Until this 2 to 12 hours, it's common for all the codes, right? Now, what is difference between these three codes? 705 is the unmonitored. Correct? 706 is the intermittent monitoring. It is for 2 to 12 hours. First code, technician started that machine and left. Now he will come after 12 hours or 2 to 12 hours. Unmonitored. No one is going to taking care of the patient that time. No one is monitoring. Like how we are, suppose you just recall your school days when your teacher did not come, he is absent. Okay, what they will say? Okay, don't make noise, don't shout. You can do your homework or anything. That is your. There is no teacher will come. Okay, so that is up to you. If your class is very disciplined, cool and study, they will do something. Right? That is unmonitored. No one is monitoring you. But then one teacher came from the next classroom. They said, okay, don't make a noise. I will come in between. That is called intermittent monitoring. He is not there, but he will come in between. Everything is good, all good. Then we'll go there. Intermittent monitoring and maintenance. Third, another teacher came and sat in your class. He said, okay, I will not teach you anything. You can do whatever you want, but I will be here to monitor you. That is third one, with continuous and real-time monitoring and maintenance. So you understood? What is common between these three codes, 705, 706, 707? The common thing, it is without video. The common thing, it is 2 to 12 hours. The common thing, it is a technician. It will be done by technician. Okay? So entire money will go to technician. Fine. Then what is the difference between these three codes? One is a unmonitored, second one intermittent monitoring, third one continuous monitoring. Fine? Good? Next set, 708, 709 and 710. Same thing. Exactly same thing. Only time has changed. 12 to 26. Now, break, you will break next tomorrow. Highlight like that. Okay, just highlight everything. Just highlight. Out of numerical, it means they will tell you where it is. 95966. Yes, these codes are out of numerical. Out of numerical means they will give you range where it is. Like 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. This is one sequence. It is the one numerical, right? If I say 1, 2, 4, where is 3? Then I will mention 3, C between 11 to 15. It means the third number of code, it's not in a numerical, it is out of numerical, it is somewhere else, where they will give you range, 11 to 15. So there also they have given range, right? 96, 966 something. So you have to go to that code, there you will find that these codes. Page number 837. New book, you will get in a different page. You bring 25 books. This one. 847. This is. 25 book, you will get 847. 24 book.
838.
Correct. 37, 38. Okay. So see, whenever you are seeing any code, just don't read it. Think how they will ask you in exam. And what, if you are getting question, what the things you have to see there. And what the other three option will be. So if I'll ask you question, I will give you two options. Suppose I'm giving you two options. Okay, the common thing is it's a unmonitored without video. Okay, unmonitored and by technician. But I'll give you now two things, 705 and 708. Now what you have to see? Correct, duration. Right? If I am giving you two options, 705 and 708, the only difference is the duration, the time limit. First one is a 2 to 12, second one is a 12 to 26 hours. That will decide my code. Right? Rest all things are very common. Clear? Clear hai? All good? Here online guys?
Yes, sir. Yes, sir.
Good. Okay, so we got two sets of a code here, 3 code, okay, which is for without video, then time 2 to 12 and 12 to 26 hours, with technician, and then unmonitored, intermittent monitoring and continuous monitoring. Now next two sets, same codes, exactly same description, only there is a one difference. Can you find out what is the difference in this code? With video,
Sir,
correct.
with video.
Very good. So it is known as VEEG, video electroencephalography. And you can see now this is the same code what we have seen earlier. Exactly same code, except video. Earlier it was a without video, now it's a with video. That is the only difference. Same by technician, unmonitored, intermittent monitoring, and continuous monitoring, and with the time, with the time 2 to 12 and 12 to 26 hours. 714, 715, 716. Good? Pretty good, right? So this 6 plus 6, 12 code is for technician. Now, next, this code 95717, 718, 719 and 720. This is for doctor. How do you know? 717, let's see 95717. It says EEG, continuous recording, physician or other qualified healthcare profession, review of recorded events, analysis of spikes and seizure detection, interpretation and report 2 to 12 hours of EEG recording without video. Okay, so this all 4 code is for video, for doctor. Now what is difference? First two sets 717 and 718 is for 2 to 12 hours. 719, 720, 12 to 26 hours. Right? Now what is different between 717 and 718? With video, without video. Done. Clear? So till now we have seen EEG. It may be with video, without video. It may be done by the technician or physician. But the highest time we have seen 12 to 26 hours. Right? Up to 26 hours we have covered the course. What if it is more than 26 hours? And it doesn't mean that patient will be lying down on the 26 hours. For entire day he will just lie down. It is they have divided that time. That 2 hours today, 2 hours tomorrow. Total time they are taking. Okay, na? That is how the patient will be lying down for the 26 hours. Very difficult, right? Until he is paralyzed. Right? Or in a coma. So, if it is now more than 26, we'll come here. 95721. Again, this is also by doctor, which is says greater than 36 hours up to 60. So 36 to 60 hours without video. 722, 36 to 60 hours with video. 723, 60 to 84 hours without video. 724, 60 to 84 hours without earlier was without video, this is with video. Up to 84 hours done. If it is greater than 84 hours, then 725 and 726 without video and with video. Now see the short notes or a summary what we have seen here. Now you can just cross check. This is a physician code. PC I have written mentioned the PC code. It's for physician. 718, 717, 718, 919, 20, 21, 22, 23, 24, 25, 26. Okay? Based on the time, based on the videography. they have done or not done video call. Clear? Similar way, if I'll show you for technician. In technician, we have intermittent monitoring. We have not seen this thing, right? In a monitoring, we have not seen in a physician code. Only for technician, we have seen unmonitored or intermittent monitoring or continuous monitoring. Good? Okay, so do one thing. Take 2 minutes, read the codes. If you want to write something, write down on your book. Okay? If you have some tricks and something, please write down. Then we'll go to this is done. EG done. Okay? You open 937 page. 838, 37. What is the pattern of questions? See, for example, if they ask me this, it will be only set of this code only the answer. No, it will not come. Some other anesthesia will not come in this. It can combine. They can come, but not with this. For with medicine, for this procedure, we don't need anesthesia. No. I'm talking, telling about the multiple choice. Right? No. Acha, options, right? Then option will be the same here only. In the sense, if we are getting a question from anesthesia, codes will be only from the anesthesia. Correct. Any subject for that. Yes. Otherwise, it will be very easy now. If they are giving you one question which have 4 different options from 4 different chapters, it will be very easy for you. This is medicine chapter. Ask you to do medicine question only then. Right? It should be a thing. They will try to confuse you more. Now like how I am giving question paper now? Same, exactly same. Okay. Exactly same. Okay. This 3 these are for technician. All for technician. See what is different here without video, this is also without. Now, what is the difference between first step and second step? Time. Now, what is the difference between one step and one step? Now, from here, it is the doctor. Anyone need fan AC like you know, na? All good. Weather is enough. For what? 15. Okay, any doubt? All good?
No, sir.
Sure. So this is done. Okay, so let's start with the again very easy not is the easiest one. This one is physical therapy, PT. In school days, every Saturday, PT class. I hope you had that one in school. Yes, that is a good thing. No? So here, PT means it's a physical therapy, or we can call it a physiotherapy. Have you ever visited physiotherapy? Physiotherapy session? Anyone? No, na? Good. Come to this 4 code, which is 97161, 97162, 163, and 164. Can I get page number for this? 864. For you, it will be whatever they have written page number, that is not for you. No, you have to do your own then. Physical therapy, evaluation, how this code depends. What are the bases of this code, basic of this code? Low complexity, moderate complexity, high complexity, and then last is the re-evaluation. What is complexity? And what is then? Then we will decide low, high, or moderate or something. Complexity, easy. If I talk about the in the CPC language, it is MDM, medical decision making. Okay, that we are going to see in the ENM chapter. If you have done, few of you have already completed ENM chapter, you know all these things. Okay, MDM is a complexity for doctor. It's not patient complexity. It's a doctor's complexity, how he can manage the problem. Okay, like if I'm not feeling good, okay, I'll go to doctor. Doctor, I'm not feeling good. What to do? You say, what happened? I'm feeling dizziness and all. Why? Because now my office work is too hectic nowadays. Okay, take this tablet if you are having any symptoms. Okay, headache and all, and then leave the work for a few days. Take a leave and go somewhere. You will feel good. I'm feeling good now. Okay. How difficult it was to find out for a doctor what is my problem and choosing what is the treatment. Actually, easily, if I say more easy example, if someone is complaining abdominal pain, today morning he visited doctor, he's saying, doctor, I have abdominal pain and vomiting. What to do? Doctor, what happened? What did you ate last night? I had some party and I went to my friend's home. I don't know what he cooked, but it was the good food. Food allergy. Your friend don't know how to cook that. It may be food allergy, it may be food poisoning. He found out correctly. Because of that, you are getting vomiting. Correct. Or it may be very spicy, very oily, or not so good oil. Whatever it was, but it was a food poisoning. It was very easy to find out what is the problem. And then doctor said, take these tablets. Okay. Now and evening, you will feel good, but continue for the 3 days. You will be better. Done. How easy it was to find out what is the problem and what is the solution for this. Easy, right? But if someone will complaining, doctor, I have a leg pain. Okay. Tell me more about this leg pain. I have from last 5 years. Oh my God, it's last 5 year leg pain. What happened, man? Nothing now. It started slowly. I was ignoring, and now it's too much that I cannot walk, I cannot run, I cannot sit, anything. Did you have you gone through with the MRI? 3 years back I have done MRI. This is my report. You will see, 3 years ago it was MRI. It is showing some infusion on the joint. But now I cannot decide what is the problem. So let's go for one more MRI. Okay. Doctor says this previous 3 years back MRI showing some infusion in your joints. It may be arthritis. Let's go for one more MRI. He came with the now recent MRI. Today he's gone through with the MRI. Evening doctor have seen the MRI report. He said, "Pakka was this is arthritis. There is no treatment. We have to do transplant. We have to do your joint replacement surgery." Now to decide arthritis, doctor did not say directly, you have arthritis. He read previous data or previous report, and to make sure he ordered again one data, again one MRI, right? To decide diagnosis, he did little work. Doctor performed little workup. And then for treatment, he did not say, take this tablet, you will feel good. No. You have to come for surgery. Even after surgery also it will not be good. But the only thing, you cannot feel pain. You will not have pain. Much pain. Definitely you will have pain. Okay. But not much. So now, treatment also, it's not tablet capsule or syrup and all. Or not an injection. It's surgery. Now just compare the first example, abdomen pain, and the second example, the arthritis wala. What do you think? Which is the more complex? Where is the high MDM? Where is the high MDM? Second one, na? Speak of them, boy. First one was very easy to find out what is the problem and what is the solution. The second one, it was the highest one. So this is the MDM, medical decision making, is a complexity for doctor to find out what is the problem and to decide what is the treatment option. Okay, in ENM chapter we will see how to decide these things. So these codes are based on that complexity only. So don't worry, they will give you complexity for at least this chapter. ENM they will not give you. ENM you have to calculate. But for this chapter, definitely they will give high complexity, moderate complexity, or low complexity. That's all. And the last one is a re-evaluation. We know re-evaluation, right? Repeated evaluation. This is physical therapy. Now, and along with that, it is given time also. So in question, if they have not provided complexity, then definitely they will provide you time. You can go in any of these things. Either you can go with the time, or you can go with the complexity. After that, we will come to occupational therapy. 97, 165, 166, 167, and 168. Same type of code based on the complexity as well as the time. But now what is occupational therapy? Okay, occupational therapy, can you tell me any idea about this with the after seeing this diagram or the images? This is occupational therapy, 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 this is, I don't know, this is, I think they are playing only, but consider as occupational therapy. What do you feel now? Okay, anyone follow cricket? Interested in cricket? No? Girls? Like cricket? Okay. Do you know Rishabh Pant? What happened with Rishabh Pant last year?
Yes, sir.
What happened with Rishabh Pant?
Met an accident, sir.
But the crucial accident was, the only good thing, he has a very expensive car. That's why he saved his life. His car saved his life. If he's traveling with his Maruti and all, he'd have gone. Okay. He met with accident. Is it 2 years back? 1.5 or 2 years. Now he is coming back now. Why it took so much time for him to come to cricket? Cricket is his occupation. Right? His bread and butter after modeling and all. Right? If will not take 2 years to recover, right? For a normal being. They can walk, they can run, anything. But cricket needs stamina. Cricket needs strength. You have to there for 6 hours in a ground, and that too you have to run. You have to be focused. For that, this training require, which is called occupation therapy, or the therapy require occupation therapy. He can, in a 6 months, he will recover. Okay, 6 months, 1 year it took to recover or the regenerate all his body parts and everything in a good condition. But now he could able to do all these things, all his house chore and other things. But coming to occupation, now his muscle should be strong enough, right? His muscle, from the leg muscle, he has to run fast and so many things. So for that, we require occupation therapy. The similar way, any person who met with accident or coming recovering from the major illness, you can see here, the doctor or nurse is teaching this lady how to hold the tray with the cup, because maybe the lady was suffering with some disease where she cannot hold that thing. Okay, here you can see they're teaching how to do gardening. Cut an apple with the left hand. So this is called occupation therapy, which is for after injury or major illness. Okay, this is again divided into the same with the complexity as well as the time. Third one, athlete training evaluation. Same thing, 97, 169, 170, 171, 172, low complexity, moderate complexity, high complexity, and re-evaluation. Athlete training. Even though we have a rehabs also, 97750 to 97755. So these are the same kind of a therapy. This is not a active treatment, it's a after treatment, right? Occupational therapy is not a treatment, it's a after treatment. Similarly, if I say rehabs, rehabilitation, that is also post-treatment phase, where patient already got active treatment, but now is coming back to his normal routine. Similar way, you can see orthotic management and training and prosthetic training. This is for what? Suppose patient was walking in 2 feet, 2 legs, like a normal human being, but one leg has been amputated because of the traumatic injury or by any disease. And the patient have a gangrene. Patient was a diabetic patient. He developed gangrene in one leg. They cut his one leg. Now what this doctor said, okay, I'll give you prosthetic, artificial leg. Is it easy for the patient to walk on that? He need training on that also. For that we have 977 602 63. Okay, so I don't know where, I have never seen any question from this segment, but we have to go with that. We have to read it anyhow. Chalo. Now come to modality. Modality code is this one. From here we got a few questions in a few exams. Okay, come to these codes. 97010 to 97028 and 97032 to 39. Modalities, it means the equipments or any things which we are using for the physiotherapy or the other therapies. Okay, if you are using anything, mostly it will be for physiotherapy. Most of the example I have seen in a physiotherapy. So the category here is two category. One category is from 97010 which is only and only for supervision. It means we don't need anyone to be monitored or holding any equipment. Okay. The second one is a constant attendance. So, have you ever seen infrared bulb in a physiotherapy? You did not visit physiotherapy, na? Okay. My sister, my cousin sister, she works in physiotherapy. She's a physiotherapist. So I have seen in her clinic. She has one red color. I asked, what is this, sister? She said it's infrared bulb, which used for some therapy. So I have seen one patient came to switch on that bulb on the back or something. Okay, and she left that room. He said, I will come in a 10 minutes. I will come and switch off that light. 10 minutes. The patient has to lie down that same position so that bulb can focus the light on that particular area. So my sister was not there for 10 minutes. That is coming under supervised. When we don't need anyone, we just come to switch on and switch off the machine. Here it is hot and cold pack. See, this is cold pack. Do we need anyone to do this one or to constant attendance? Do we need that a doctor or technician should be in front of us? Then only I will place that hot and cold pack. No, right? Okay, so first one is the hot and cold pack, then traction, mechanical, okay, electrical stimulation, unattended, vasopneumatic device. If you want to know this thing, just Google it, okay, what all these things are. Paraffin bath, whirlpool, diathermy, infrared, ultraviolet, like hot and cold pack I told you. Traction means there will be some machine where they have to do movement. This is for people who is coming after fracture healing, mostly on the joints and all. Okay, so they will do very light exercise. And then paraffin bath, if you have seen the melted wax that will be applied on the particular area, that is also after fracture, just to strong the muscles or to relieve the muscle. Okay. Infrared, ultraviolet, same. So for these things, we don't need any attendance. We don't need anyone to help us. Help us means help patient. Okay. But the second category where we have a constant attendance. We have 6 things. And you can see for everything they have given time. 6 and 5 you consider. 39 you can leave it. Okay. 32, 33, 34, 35 and 36. For this, they have given time. It means we need patient. The example here, 35, ultrasound. Ultrasound, this is not the same ultrasound which we have seen in a radiology. In radiology, we have seen for a diagnostic purpose, right? But the equipment is very same. There also they will apply little gel and then roll the what we call the ultrasound probe. Okay, but this ultrasound, the physiotherapy ultrasound, that probe will emit sound waves which can be used to healing the muscle. So this is not for diagnostic purpose. That is for therapeutic purpose. Can I take that probe and roll over to my body? I don't need any doctor. No. We need doctor for that. That is why it is coming under here, constant attendance. We cannot do this thing for us by our own. We need one doctor or technician. Okay? That is why it is coming here in a constant attendance and it will be billed for 15 minutes. Good? Acha, one more thing now. Sometime, not even sometime, many times you will see some code which is coming under unlisted. Like here, 97039. So unlisted, for CPC exam point of view, you will never code unlisted code. So you can simply ignore it. Unless our book will tell you to code that one. in some topics, we have a guideline that for this condition, code unlisted code. Okay, we'll see the next topic, which is a pathology. There I will show you. That book will only tell you for this particular condition, we don't have a code, then you can go for an unlisted code. That time it's okay. But other than that, you will never use unlisted code for your CPC exam. That is for our real-time coding. That is why I'm not focusing on 39 as of now. That what is 39, what is unlisted. Leave it. Good? Okay, can you solve this question? No, I need to see the book also. You can give me answer. Do you need book for this? Just check how many things they have performed. Physical therapy, manual therapy, and modality. How many things? 3. Where is the code of 3? D. That is your answer. Go and check each code. 97110, 97140, and 97010. That you can check. So in exam, don't open book for these things. Just mark it. 3 code, 3 procedure, 3 codes. That's all. If you have time after that, then just for time pass you can read your book. That also some people get that much time just to do time pass. And those people either they will get only 75 marks, up to 75, or they will get more than 90. Not between that, if you are getting time. Last month, 2 girls got from my previous batch, they got 97 marks. So how you got? Even I will not get that much mark. I'm joking. They got a 97. That's very nice. So see, 97 is also not impossible now. So now we have a record for 97. So if anyone can break that 97, you will get 98 marks. Okay. It's not impossible. It's easy exam. Huh? You got that this course? Okay, this thing. Don't go with color. I may bluff with you. Okay. Check the first code is same, 97110. Second code is also same, 97140. Only third code you have to see. Is it 97010? Is it 97032? Is it 97014 or 34? What is that? E-steam, electrical stimulation. How do you know this is constant attendance? Because that is in a both. You can see if electrical stimulation is a 97014 also. Correct. They have given time 15 minutes. In the 014, they have not given time. Right? Time given, it means it is from the second part or constant attendance. Okay, that is done then. Okay, acupuncture that I have seen in a Jackie Chan movie. You know Jackie Chan? 97810 811 813 814. 810, 811 is without electrical stimulation. 813, 814 is a with electrical stimulation based on the time. Initial 15 minute and additional 15 minute. Okay, next one, CMT and OMT. CMT, chiropractic manipulative treatment, and OMT, osteopathic manipulative treatment. The code is 98940, 941, 942, 943, and 943 only. And for OMT, 928, 925, 98, 926, 27, 28, and 29. Okay. OMT, CMT. This is for mostly on the joints. Okay. Joints, even after COVID, this CMT practice, this is going very good now. Okay. Because CMT is only dedicated for spine. You must have seen some videos also. Okay, you just type over YouTube or in YouTube CMT or chiropractitioner, you'll get very good videos, reels and all. Where the person has to bend and the doctor will just push and then you will get crack sound. Okay, so this is for spine. 98940 is a spinal 1 or 2 reason. 41 is a 3 or 4 spinal reason. 42, 5 spinal reason. And 43 is a other than spine, any reason. So now spine has been divided into 5 reasons. What are those? Correct. First one is a cervical, your neck region, neck spine. Thoracic, your chest spine. Lumbar is your back spine, lower back. Then sacral and coccyx. So coccyx means this is sacroiliac or pelvic part also. So if they are treating 2 levels, cervical and thoracic, what will be called? PO0. Okay. If they are taking cervical, thoracic and lumbar, 41. 3 level, na? Cervical, thoracic, lumbar. And don't worry how I'll remember this. This is just this is given just about to the 98940. Can you see that that paragraph? 98940 code. Just about that, you will find the same. What are the spinal levels? Did you get it? Yes, no? See? Controlled sudden force and twisting of the spine. And extra spinal region. Achha, extra spinal means any region. Any other joint except that 5 parts of spine. Apart from spine, any other, just code 98943. It may be 1, it may be more. Head, neck, extremity, anything. Okay. Now the osteopathic manipulative treatment. This is also similar to CMT, but the only difference is this is not dedicated to spine. This is for all other reasons. So here also you will get the same 1 or 2 body reason. In previous topic we have seen that is a spinal reason. This they have given body reason. 3 to 4 body reason, 5 to 6, 7 to 8, 9 to 10. What are the body reason? that you will get just about to 9 and 925. Head region is 1, cervical is 2nd, thoracic is 3rd, lumbar is 4, sacral is 5, pelvis is 6, lower extremity is 7, upper extremity is 8, rib cage 9, abdomen and viscera 10. Okay. So they will give you, so first you need to decide whether it's CMT or OMT. If it is CMT, only focus on the spine. If it is OMT, focus on the other regions also. No need to be in a hurry. Okay, better just read the about this one, the reasons referred. Okay, first you need to remember CMT is only and only for spine. And then just if you want to calculate the number of reasons, go with that paragraph. Good? Okay. Let me know if you have any doubt and then we'll go with the radiology part. Radiology, immunology. And then we are done. Done? So for few of you, radiology has been completed. Okay. That time I told you that radiological examination, if you are doing for ultrasound or something, that is only for our soft tissues and muscle, right? It is not for our blood vessel. Okay. Right now, the ultrasound or scan, any scan, if they are performing, that must be for. And but if I want to take a duplex Doppler scan, which is only dedicated for blood vessel blockage, to find out the blood vessel blockage. Remember what we have seen in angiography? Angiography we have done only and only for coronary on this chapter. We have done for coronary angiography, which is for coronary blood vessel, right? Same thing if we will do for any other thing, any other blood vessel, for extremities mostly, it will come to this medicine topic. Okay, so first thing, one second. Okay, people are working today. So 93880, 93882. We have a duplex scan which is for extracranial. Cranial means? Yes, here online people, what happened, man? All are very silent today. Cranial, anyone know cranial?
Headphone.
Correct. Okay. Head part or brain. So they said extracranial. Extracranial means out of a brain. Not from this part, other than this part. Any other blood vessel other than our skull part. It may be anything, but not anything. Actually, for all other parts, we have a separate code, except the neck region. Okay? So extracranial, you can write down neck region. Carotid artery. Carotid artery. Carotid arteries are the arteries which is supplying blood to our brain, which is little deep on the side. Okay, so you have to, if you want to kill someone, cut that artery. The patient brain will not get blood. I will teach you many methods to kill any person. There are medicine also. So 93880, 93882, it's for carotid artery, which is on the neck region. They given extracranial, but extracranial means out of brain. Out of brain means it's a neck region. Why not other body part, chest, arms, legs? Because for that we have a separate code. Okay. So bilateral, complete or bilateral. Complete, it means both sides, left and right. If both carotid artery we are doing scan, it will come 93880. If only one side we are taking, 93882. 93886, 93888, 93888. That is for intracranial. Now intracranial means inside the brain. Now we are talking about the brain arteries. Here also complete and limited. Complete means if you are taking all the arteries in our brain. If you are measuring or the monitoring all the arteries from our brain, that will be considered as a complete. If not all, it's a limited. 93890 and 892. Transcranial Doppler study of the intracranial artery. So this is for this course which we are going to see right now. That is for any specific purpose or any specific method. Like in 93890, you can see that is vasoreactive study. That word should be there in your question. Vasoreactive. Okay. Second one, 93892, emboli detection without intravenous microbubble injection. Emboli, it means blood clot. I want to find out blood clot in the brain artery. And I'm not giving any injection for that. Microbubble injection. I'm not giving it. Then it's a without microbubble injection. But suppose if I want to check whether there is any blood clot in my brain artery and I'm giving injection also to me. So that is a 93893. Highlight emboli detection. And if you do not know the name, the meaning of emboli, write down blood clot. And if really you don't know, write down better. Don't feel that I will remember in after 2 months also. You may remember, you may not. So better write down. Emboli means it's a blood clot. Done? (93895) quantitative carotid intima intima media thickness, and carotid atheroma evaluation bilateral. So this is also for carotid artery, but for specific intima media thickness and atheroma evaluation. I don't know what is these things. If you know, if you want, I can search and tell you. Frankly speaking, I don't know what is this intima media. If anyone is from medical background, you can tell me. You know this thing. Fine then. If you don't know, then also fine. They will mention this word. Although it is a medical coding. Good morning, Sarji. Okay. Although it is a medical coding, but they don't want you to be a medical practitioner. Now, if you're not from medical background, well and good. They will give you these things. You know, carotid intima media, they will give in a question if they are asking this thing. Don't worry. NIPS, I will come. 9.3, 9.25, 9.26. Just check this one, guys. Okay, so this duplex scan artery lower extremity. The same thing, 9.3, 9.25, 26. What we have seen in a carotid artery, we have seen in our brain, right? Now it is for extremity, lower extremity bilateral. Extremity means your arms and leg. So this is lower. Lower means your leg. They're talking about the leg only. Bilateral, both sides. And remember, this is for artery. We have two types of blood vessel, right? Artery and vein. What is the difference between artery and vein? Oxygenated and deoxygenated blood. That is one definition, but it's not true always, right? We have one exception on that. Pulmonary artery and pulmonary vein. So artery carries blood away from the heart. A for artery, A for away. Just opposite is a vein. Okay. So artery carries blood away from the heart. It means they are supplying on the organ. So 99, 25 and 26 is a duplex scan arterial lower extremity bilateral. 25 is a bilateral, 26 is a unilateral. 93930 and 31 is again duplex artery for upper extremity. Same, bilateral, unilateral. Oh, it's not there. Here. Upper extremity arteries, bilateral, which will consider as a complete, and unilateral, which will be considered as a limited. Okay. Now 93970 and 71. That is for venous, veins. It may be for upper, it may be for lower. Okay. Same code we can code for upper also, same code you can utilize for lower also. Again, bilateral and unilateral. Bilateral will be considered as a complete. Unilateral will be considered as a limited. So we have covered head region, intracranial, extracranial neck region. We have covered all four extremity. Now what is pending? What is pending in your body? 2, 3, 4, 5, all covered. What are the pendings? Sorry. And that is face, okay, leave it. Face you can ignore. Other part, trunk part, no boss, chest, and our abdominal area, right? Our hip area, that is pending. So for that we have another one which is for this. Oh, who is joining now? 93975. Duplex scan of arterial inflow and venous outflow of abdomen, pelvis, scrotal content, and retroperitoneal organs, and everything on the chest, abdomen, and our sideways retroperitoneal and a genital part. Everything will be covered by 75 and 76. Now here we don't have a bilateral because all the organs are not bilateral here, right? So what they are giving here? How to decide whether which is complete or which is limited? We have to find two things: either artery and vein both. Okay, if they will document artery and vein, both they have documented complete. Only one they have documented limited, or they will document inflow and outflow. Inflow and outflow. You can see here arterial inflow and venous outflow. Artery carries oxygenated blood or away from the heart, right? So any organ which need oxygen, that organ will tell brain, "Bhai, I need oxygen." Brain will say, "Okay, wait, I'm sending the oxygen by blood." So that blood will be artery. The blood vessel will be artery, which will carry oxygen to that particular organ. Now that organ will say, "Bhai, I received oxygen, but I have carbon dioxide. What to do? And waste material." Blood vessel said, "Give me that one." The blood vessel will take that one. Now it's a deoxygenated. Now artery has converted into vein. So inflow means the oxygen is coming into the organ. Outflow means the carbon dioxide and waste materials are leaving that organ. Okay, that is a vein now. So that is why arterial inflow and venous outflow. Suddenly this vessel will get changed. Once I will give, like suppose I have 1,000 rupees. I say I have 1,000 rupees. My friend will come by, give me 1,000 rupees. I'll give him. Now I am beggar now. I have 0 rupees. Right. Suddenly in a moment I am not a poor man and my friend is rich. 1,000 rupees I have given to him. Same thing happens in artery and vein. Artery carry oxygenated blood, vein carries deoxygenated blood. This will cover any organ, any small part of organ, and will make online people, you can spread your hand and join your finger with each other. Okay, just try to make one globe. So your hands, your arms will be artery and vein, and your fingers will be capillaries. So all the transaction of oxygen, food, waste material, everything will be done by the capillaries. Okay, and there is the moment where artery will get changed into vein. So if you are getting a question in exam, how many blood vessels we have? We have 2. But if there is option 3, if they have given 3 also, choose 3. Artery, vein and capillary. If they have not given capillary, choose 2. Okay. So here 9397576, abdomen, pelvic, scrotal content and retroperitoneal organ, arterial inflow and venous outflow, complete study. Either arterial inflow and venous outflow, limited study. Okay, any one is limited. Then abdominal area 78, again inferior vena cava, aorta. This is chest region. Aorta is a chest. Inferior vena cava is a between chest and abdomen. Iliac vasculature. Iliac is in our lower abdominal area, where the artery will divide into two parts, going to the leg. Okay, that is called iliac or bypass graft. So 78 and 79 is for blood vessel, mostly for the aorta, inferior vena cava, iliac vasculature, or any bypass graft. 998081 for penile vessel. This is for genital organ, male genital organ, penis. Complete and limited. Can you see this question? Right saphenous vein. Saphenous vein is in the upper extremity. So 93970, if they're asking for right side only, so it will be 71 as a limited, right? Unilateral or limited. But if they are asking bilateral, do not quote 71 two times. Unilateral, bilateral. No. We have a separate code for bilateral. Can I use 50 modifier in a 93970? 5050, check 5050 modifier. Pause.
No.
That is for bilateral modifier. Can we use that 50 modifier?
No, sir, we can't.
Why?
Because in the code itself it's mentioned, no? Bilateral.
Correct. So why I asked you now? What happened? Sometimes we read so many advanced things. Very advanced things we will know. Even though engineers, you ask an engineer so any complexity problem, they'll say, this is solution. But if you ask a very basic thing, just give me 14 ka table, they don't know. For example, same thing happens if you know all the advanced thing. But once somewhere you will get confused. Can I use 50 modifier on that? Because you will get an option on that. You have a 4 option, wherein 2 option you have already eliminated for 71. 2 option you have, that is the same code 93970. One without modifier, one is a 50 modifier. Then if in higher bilateral to hai, that can we quote 50 modifier? The concept, that time concept will help you. Why we are using 50 modifier? Why we use 50 modifier in the scenarios? When I have to double the payment. I don't have a code for bilateral. Okay? I have code only for unilateral. Like a X-ray. I don't have a code for bilateral hand X-ray. I have only hand X-ray code, which is either for right side or left side. But if doctor has given bilateral, doctor has performed bilateral procedure, I want to double the payment. That time I can use 50 modifier just to double the payment. Because I don't have a double payment wala code. Okay? But here in this scenario, already code description says it's a bilateral. No need to give extra information or double information. If the insurance people will get to know 93970, they know that is for bilateral extremity. So I will give double wala payment. Why you are again coding 50 modifier to say this is the bilateral? I know that one, boss. Right? So this small thing, please be confident. You will remember, I know that you will remember always. But be confident. Don't get confused by looking the options. Okay, so these are done. Now come to the last part of the radiology. Here, That is NIPS study, non-invasive physiological study. 93922, 93923, 93924. 3 codes we have for this. This is very special study. Okay, and this is very little complex also to perform. Literally you can see the description of the code 23 and 22. Like a 6-7 lines. Right. So the thing is, what they will do, this will be performed in extremities, upper extremity or lower extremity. They will measure some pressures, the pressure on some points, and calculate ABI index. What is ABI? Not Amitabh Bachchan. This is ankle brachial index. Okay, ankle, leg, brachial, our arm, index. They will take pressure on the ankle, they will take pressure on the branch, our arms, and divide it. So that they will get one number. That number will be known as the ABI. You can see there, where is the ABI? This is blue color, ankle brachial index. Okay. Similar way, in that they will calculate some waveform, plethysmography. Okay. So there will be, how do you know that this my question belongs to these 3 codes? Either you will get NIPS word, letters, okay, or you will get non-invasive physiological study, or you will get ABI, or you will get waveform, or you will get plethysmography on the levels. So these are the 4-5 things. By that way, you will get to know this is my question, belongs to NIPS study. Fine. Now, if you got one question and 2 options they have given. One, 93922, second, 93923. How you will choose? What will be the basic? Can you find
Complete and limited.
Yes, what?
Levels.
Levels, very good. Levels means where they are taking pressure apart from the ABI, where they are measuring, why they are performing it, how many levels they have performed. So if it is only 1 or 2 level, it's 93922. If they have performed 3 or more level, 93923. Easy? By this way, it's easy. Okay. Now, the complex part here, or not complex, the interesting part here is that this 2 code is only for either upper extremity, it should be bilateral, okay? If they are performing on the both arm, cool, we can code it. If they are performing on both leg, fine, we can code it. Either they have to perform on the both arm or both leg. Okay? Either both arm or both leg. But what if they will perform on a 1 arm or 1 leg? We have a guideline just below to this code. See, 52 for unilateral study. Did you get that? Just below to 93922, you will get this. Please highlight. Fine. 52 modifier is for reduced service. This code is for bilateral. If they have performed one unilateral, I don't have code for unilateral. What I can do, I can cut the payment. Okay. But for the second code, 93923, it is not applicable. Can you see 23, 93923? What we can quote for unilateral? Yeah, what is the guideline? 93922. Okay, chalo, I'll show you. Guys, you can see your chat box. Okay, I will just imagine a number I will write. 93922, suppose it is $100. You also can see here. And 93923 is a $200. Okay, this is for bilateral study. What if they will do 93922 unilateral? I will use 93922 52 modifier. Right, for unilateral. 52 modifier, cut the payment half. So what will be the valuation of 93922 with 52 modifier? Correct, $50. All correct. If they have performed 923 unilateral, logically I should code 93923 with 52 modifier. What will be the value of that? $100, right? If I want to pay unilateral 923, it should be $100. So they are saying, don't code 52 modifier with 23. Instead of, you want to give $100 only, na? So better code 93922 because the value will be same. Clear? This is why we don't add 93923 with 52 modifier. So 93923 with 52 is equal to 93922 is equal to $100. Clear? Good. One more thing, na? After this, one more the guideline we have. Acha, I told you it is either for upper extremity bilateral or lower extremity bilateral. What if doctor is over enthusiastic and perform in all four extremity? Suppose 1 or 2 level only. I can code 93922 only for bilateral upper extremity or bilateral lower extremity. What if they have performed all four extremities? How much payment he should get? Only $100 or you got my question, right? 93922 is $100, which is for either lower or upper extremity. But if doctor has performed both upper and lower, then what you can quote? Achha, how much money you want to give? 200, right? 200 means we have to do double. We have to pay double because for lower only it's 100 and for upper also it's 100. They have performed both. 200 now. So I cannot simply code this code 2 times. I have to use 59 modifier. 59 modifier like this, 93922 and 93922 with 59. Because 59 is a distinct service. If simply I will mention 93922 into 2, they will deny the payment. They will say, nahi yaar, this is only for that we can code only one time for lower extremity or upper extremity. They don't know that doctor has performed in all four extremity. So we will mention by this is a distinct procedure. They have performed in a separate site, not on the same site. And same guideline is for 93923 also. Okay. For all 4 extremities, we can code twice this thing, but with using 59 modifier. How do I know? It's given in a book. And the next code we have for NIPS is a 93924, which is nothing but just with the treadmill exercise. Nothing, no level, no 59, no 52, nothing. Just treadmill exercise. So your vascular part is also done. Fine. Not last, we have one more. Modern season to 2 minutes ka kaam. Allergen immunotherapy. Now, you know allergy? Everyone knows allergy, right? You say, "Hi, yaar, I have allergy with the dust. We have allergy with the certain foods." Like yesterday, day before yesterday, I got to know one of my colleagues. She has allergy with the paneer. She don't eat paneer. That is. So allergy, you all know, right? There is an anaphylactic reaction if you are consuming or you are being contact with that particular things, right? But suppose suppose you have allergy with something. Whenever you go out, you get some rashes, but now you don't know you have allergy with what. Is it because of a dust? Is it because of a sunlight? Is it because of you are going to your friend's home and he or she is not hygienic? Because of that you are having allergy. You have allergy whenever you visit your friend home. It may be dust, also outside dust. How do you know that? How you will find out with what particular thing you have allergy? So for that we have this procedure which is known as the allergen immunotherapy. I'll tell you how they perform this procedure. Okay, I have seen this procedure when I was in a hospital. I was working in a hospital one day. See, here they are applying a drop. I have not seen a drop. I have seen an injection part. So what they do? One day when baby came, a small kid, not baby, a small kid came for a allergy this test. So doctor has prepared one allergen. The baby was expecting that I have allergy with this. So they have prepared one solution. They measure the forearm diameter. Okay. And then the doctor made like this checkbox and injected very small amount in a different checks with a different concentration. For one check, number 1, they have injected 0.1 ml or 0.01 ml. Second check 0.002, like this, different concentration. Before that, he measured the arm diameter. Then patient went back. Doctor instructed the parents, don't wash this one and don't allow kid to touch that part. Let it be for 24 to 48 hours. Come after 2 days. After 2 days, he again measured that part. If there is a swelling, it means patient have allergy. That is a primary test for this. Because if that part, that the solution what doctor made, it is there and that is not in a blood vessel. It is just below skin, so that it will not harm other body part. Okay.
So if patient have allergy on that particular things, the cells will start accumulating on that part and cause swelling. How much swelling? For that they have an index. This is how they perform this thing. Okay. So now 95115. 95115. Professional services for allergen immunotherapy not including provision of the allergen extract. Write down injection code. This is only for injection. Not for preparation of an extract. Okay. Did I give you example for like this? Yeah, immunology I have given you example, right? Like one money is for injection, one money is for administration, right? 50 rupees there you will give to doctor for medicine only, and 50 rupees extra for injection. But suppose you buy the medicine, then you have to pay only 50 rupees for injection, right? Same thing. Extract preparation, separate money. Injection, separate money. So 95115 and 95117 is only for injection, not for extract preparation. Nine five 120 125 130 131 32 33 34. Make a set. Injection plus extract. You can write down injection plus extract. And in 95115 and 117, write down only injection. In 115, 117, only injection. 120 to 120, 134, injection plus extract. One 145, 146, 147, 148, 149. Make a set. You can ignore 144 as of now, na? 145, 146, 147, 48, and 49. Write down only preparation.
Sir,
Yes.
extraction and preparation both are same or different, sir?
Extract and preparation is same.
Okay, sir.
Okay, it's same only. So 145 to 149 is done. Only preparation. Similar way, 165, 170. This is also only preparation. Now I told you to mark two category, right? Both are only preparation. Now what is the difference? You can see 165 is when they are preparing. Okay, before that 145, 46, 47, 48, 49. This is a preparation only and only for sting insect venom. Sting, the any animal or any, not animal, any insect which sting and insert venom in the body, like honeybee. Okay. So this 5 code is for insects only. That too, sting insects. 165 is other than this insects. Anything else than this insects. $170 whole body extract by biting insects. Okay, insect, sting insect and biting insect. These are two different. Snake bite, honeybee sting. Okay. Now 144 is also preparation only, but that is for vials. When we are preparing vials, you know, in the COVID vaccination time, the COVID vaccine comes in a vial that have multiple doses. So if you remember in the news and everywhere they says if go in a batches, because when they open the vial, within 1 hour they have to consume 8 doses. If only one person is coming in 1 hour, he will give injection, all 7 doses waste. Right? I think I'm saying correct. I think that is 8 doses. Right? So vials have a different doses, multiple doses. So for vials, 144. Clear? So now tell me, so now what happened now? One time, see this question. Patient provided with injection for allergen immunotherapy. Patient bought the injection extract. Means doctor did not prepare. Patient bought from somewhere else. What you can call? 115 is only for injection, right? Only one injection. So 115. Second question, the doctor is preparing. Okay, doctor is preparing. Doctor is preparing and giving injection. The code should be 95120, right? But what happened now? Few years back, this question was asked in exam. And they did not give option only, 95120. No. The answer is somewhere else now. So suppose if I want to go to the doctor, okay, I have to pay 100 rupees for vial, means medicine, and 100 rupees for injection. So doctor asked me 200 rupees total. Now I am not giving 200 rupees to him. 120 was not an option. But I am asking doctor for what 200 rupees? Generally we should not ask, right? But then he says, by 500 rupees, my fees to inject you. 100 rupees medicine which I bought for you or I prepared. Then fine, take this 200. But I did not give him directly 200 rupees just because he asked. I asked him, what is the charge by? Give me that calculation. Right? So 120 was not an option in exam, which is a direct answer. Instead of that, they have given this answer. 95115, which is only for injection, and 95165, which is only for preparation. So 95120 is equal to 115 and 165. 120 is a preparation and injection. They did not give you direct answer. The other options are separate preparation and separate injection. So the answer must be this one, 115 and 165. Both are correct. Please write down this answer. On top of your book, write down 95120 is equal to 95115 and 95165. Clear? Okay, so the immunology is clear. Yes, sir, not immunology. Allergen immunotherapy is done. So be aware. I hope you have wrote down whatever I told you there. See this? Go with this question and then we have a 5-minute topic. 5-minute topic is pending then. We could not complete today's radiology that we have to do tomorrow then. You can ignore J series code, that is the ICD. You can ignore 9920 series, which is for ENM. Check 115 or 117. First check 115 or 117. See here they did not give you 120 code. How many injections?
2, sir.
2. So 117.
9117.
So B option cancel. D option also you can cancel because 25 modifier we cannot append other than ENM code. So B and D cancel. Now we have A and C. Tell me 144 or 165.
44, sir.
Sir, it is 165.
951144, sir.
Okay. 144 is professional services for the supervision of preparation and provision of antigen for allergen immunotherapy, single dose vial. Okay, single dose vial. While 165, 165 is the professional service of the supervision of preparation and provision of antigen of allergen immunotherapy, single or multiple antigen. Now tell me, is a single dose vial or a multiple antigen?
It is multi-dose. Yes.
It's actually multiple. So the answer will be C here. And how many doses? 20, because each vial contains 10 doses. Here, 2 separate injection for both vials they have given. It means 20 doses has been given. Answer will be C here. Please check. Let me know if you have any doubt. Just 2-minute work. This happened when we have some OT. In my company, they said we have a both day OT for next 2 months. I'm not getting money for this now. My coders will get much good money. Clear this question? Okay, come to the last part, which is the moderate sedation. Can you please come to these codes? Now in anesthesia code is 0 series code. Okay, we know anesthesia. What is that? When the patient is in any surgery or any procedure, we should avoid pain. That time you will give anesthesia to patient. Okay, this is also type of anesthesia, but here the patient will not be unconscious or something, and this is not for any specific surgery. This is for any procedure where patient may feel uncomfortable. Suppose I'll tell you, I'll do endoscopy of you. Endoscopy means I will insert one pipe to your mouth till your stomach. You'll be okay, fine. No, na? Some people say also, yeah, okay, fine, I'm a strong man or strong girl, I'm independent. Come, do that one. Okay, so that may happen. But for most of them, they'll say, no, I'm not comfortable with that. Can you do something? I can give you moderate sedation then. Moderate. It's not high sedation. Sedation, you know, right? Little unconsciousness, little sedatives. Like how if you are not working in a night time, okay? If you never work night shift, then what will be your status at night 2 o'clock? 2 to 4, 2 to 4. It's the worst time for people. Okay? Right, nighttime people. So, you know? Okay. So that time how you'll feel? I'm fully sleepy. So this is like sedation. Same. Okay. That too moderate one. Okay. So for this we have category 95, 150, 152, 53 comes to in one category. 55, 56, 57 comes in another category. Okay. Now what is the difference between this one? First thing, the first category 951. You can refer this table. See, we need to check whether there is a 2 physician or only 1 physician involved in the procedure. Procedure means if patient is coming for endoscopy. So is there the same physician who is doing endoscopy is performing moderate sedation, or he is calling some other physician for performing moderate sedation? If I'll say no, I will perform both. The code range will be 150, 152, 153. Okay. But if I say, no, I'll perform only moderate sedation, I'll perform only endoscopy, you come for moderate sedation, then the code range will be 55, 56, 57. So 51, 52, 53, same physician, 1 physician only, primary procedure as well as a moderate sedation. But if there is a 2 physician, 1 for primary procedure, 1 for moderate sedation, then the code is a 55, 56, 57. The second thing, age. Third thing, time. Only 3 things matter for the moderate sedation. Physician is same or not? What is the time period total and what is the patient age? Suppose I'll tell you, patient of 10-year baby, he is coming for endoscopy, and Dr. A is performing endoscopy, and he is the only one who is performing moderate sedation. Moderate sedation has been done for 30 minutes. What you will go? First thing is the same physician, category 1. What is the patient age I told you? 10 years, right? So it's over than 5. What is total time I told you? 30 minutes. Can you come to 30 minutes? 23 to 37 minutes. 5 year or older. The answer will be? And? Done. 9 and 152 and 153. Into 1, if you will not do, then also it's fine. right? So there is only one doctor. We have to go only on the first row. Then you check the time, 30 minutes, and then you check the age of the patient. You got the question, you got answer. Similarly, if I tell you the patient age is 4 years, okay, procedure 1 for moderate sedation, and the total time is 60 minutes. 2 doctor, age is 4 years, 60 minutes. Tell me answer. Tell me, give me answer this. It's easy one. 4 years, 60 minutes, 2 doctor. 2 doctor means second row. 60 minutes means 53 to 67.
115 plus 9
Why 152?
7 into 3.
Said 2 doctor. 2 doctor means second row. This one 55, 56, 57. Right? So it will come under 55, 57 into 3. 3. 2 doctor, huh? So 2 doctor means this is for 2 doctor. I asked you for 60 minutes. We have these 2 codes for 60 minutes. The age I asked you less than 5 years. So answer will be 55, 57 into 3. Will the answer? Got it? Yeah, no? This one. This one. So now this is one doctor and 2 doctor. Okay, first row write down 1 doctor, second row write down 2 doctors.
Sir,
Yes?
sir, into 3 means, sir, 2 doctor into 3, how?
Into 3 we will make, na? 99155 and 99157 into 3. That would be your answer.
So what will be 3 indicates, sir?
Why?
Sorry, what?
The 3 what will indicate, sir?
Sorry, 1 second. Arfaq, one by one. Yeah, Arfaq.
Sir, the what? 3 what will indicate, sir? The
3 means, what 3 indicate? Because that is for time. If you see 57, that is each additional 15 minutes. So I did not tell you how to calculate. I just told you to refer this table. Each code is for on an average 15 minutes. So if I ask for 60 minutes, how you will code 60 minutes? 15 plus 15 plus 15 plus 15. So total 4 codes.
Yes.
Right? That is what 55, 1 and 57 into 3.
Got it, sir. It will calculate the 15 minutes. So the
Correct.
1 means 15 minutes.
You can see the codes 51, 52, 53, 55, 56, 57. All these 6 codes are for on an average 15 minutes. So better, because in question, in exam you might not get 15, 30, 45, 60. Okay, they may give you 52 minutes. Then so better know how to use this table. Finally, medicine topic finished. Okay, let me know if you have any doubt. Check. I'm so sorry for this. Let me know if you have any doubt. See, when we ask money now, that we are also working on Saturdays in office for our coders or teachers, or manager will say, no, you are not doing anything now. Okay, we are not doing anything, but we cannot leave this laptop also. No, they don't understand this thing. Many people, they have some plan, but still they have to carry this thing. And my body is dead. Just 2 minutes, guys. So sorry for this. Any doubt? Which we discussed yesterday, today, till today. You read the previous topics in a book? Okay. Now you got. Okay, then we'll take time. Spend some time in a book with books today. Okay. And I need to check what are the changes in the 2025 book. Okay, they have related vascular activity. Fine, good. So the activity code they have deleted. That's what we have seen now. Extremities. So now you will get in 25 book, you will get it is polite. You will get this dark dot in any code, that means it's a new code. Okay? Chalo, so tomorrow we will discuss the radiology question paper first, and then we'll start a new topic for you. Fine? Okay, guys. See you then. Thank you so much. Tomorrow.
Sir,
Yeah.
sir, I have